Everybody, welcome to our first ever fully virtual Safety Net Clinic Week Community Showcase. Due to COVID-19, this year's event is virtual, and I want to thank you so much for joining us. We know that safety net providers are under more stress than ever, which is why it's so important this year to recognize their incredible impact across the state. This is our 11th annual Safety Net Clinic Week, which is a week that is dedicated to promoting awareness of the unique challenges facing our rural health clinics, rural clinics, and then community safety net clinics. There are 52 federally certified rural health clinics across the state and about another 50 rural clinics. Rural health clinics are diverse as they may be owned by the local town or county, owned and operated by a provider, and they may also be owned or operated by the local hospital. The clinics primarily serve Coloradans who are uninsured, underinsured, or publicly insured, and they're paid on a per visit encounter rate, which is about $110 for Medicaid patients and about $83 for Medicare patients. This funding often really doesn't cover the cost of the operations, which means that the rural health clinics are also dependent upon other funding such as grants, donations, and staffing models that include volunteers. It's also really important to note that rural health clinics do not receive any federal funding outside of their encounter rate dollars. These unstable funding streams really leave the safety net clinics that serve our most vulnerable individuals at financial risk without really many opportunities to expand access. Despite these challenges, our clinics provide over 1 million visits a year to approximately 344,000 rural and underserved Coloradans. Today, we're happy to show you through the video that features the Saguache Health Center, which is part of the Heart of the Rockies Medical Center. This is a newly minted, federally certified rural health clinic, and they really have been greatly impacted by COVID-19, as has the community and the clinic that the clinic serves. Today's video will explore how COVID-19 impacted one clinic, one health system that it's a part of, and the community it serves. It also looks to explore the silver linings that have emerged from this event, including the rise in telehealth to provide healthcare access, maintaining safety for patients and staff. And it's also important for healthcare advocates and state and elected officials to take a look inside our safety net clinics and meet the healthcare providers and the community members who support these clinics. So thanks again for joining us online. We appreciate it. I'm really privileged to be able to introduce one of our special advocate partners, the Lieutenant Governor, Diane Primavera, and she'll be reading the proclamation from Governor Polis. So the Lieutenant Governor is the leading patient advocate who spent 3 decades fighting for every Coloradan's access to quality, affordable health care. Before becoming Lieutenant Governor, she served as a state legislator and the CEO of Susan G. Komen, Colorado, which is one of the largest organizations in the country that's dedicated to breast cancer prevention, treatment, research, and education. She's a lifelong Coloradan and Broomfield resident. And I'd like to thank you again, Lieutenant Governor, for reading our proclamation and for all of your great work that you do across the state. And thank you all for attending today's screening, and hope you enjoy the video, and happy Safety Net Clinic Week. Thanks, everybody.
Whereas there are 43 community safety net clinics, CSNCs, and 52 federally certified rural health clinics, RHCs, located in 41 counties throughout Colorado. And whereas these clinics were established by civic-minded individuals, healthcare professionals and systems, and community organizations who recognize that there are many individuals, children, and families in need of access to healthcare services in rural and underserved areas of Colorado. And whereas these clinics provide essential healthcare treatment and preventive services to vulnerable populations and communities throughout our state. And whereas CSNCs and RHCs are safety net providers, primarily serving Coloradoans who are uninsured, underinsured, or insured through public programs like Medicaid, CHP Plus, and Medicare. And whereas RHCs are reimbursed per encounter by Medicaid and Medicare. However, these rates often do not cover the full cost of providing primary care. And whereas RHCs receive no regular federal or state funds, leaving them reliant on complex and vulnerable funding streams. And whereas CSNCs and RHCs often lack sufficient workforce and technical resources, but are creating innovative solutions to delivering patient-centered, high-quality care in an efficient and effective manner. And whereas we express our appreciation and gratitude to these clinics who dedicate their time, energy, and resources to serving their communities. Therefore, I, Jared Polis, Governor of the State of Colorado, do hereby proclaim the period of August 16th, 2020 to August 22nd, 2020 as Safety Net Clinic Week, given under my hand and the executive seal of the State of Colorado this 16th day of August, 2020, signed Jared Polis, Governor.
Heart of the Rockies Regional Medical Center is a regional healthcare system based out of Salida in Chaffee County, Colorado. They serve visitors to and residents of the Upper Arkansas Valley, which includes Salida, Buena Vista, Villa Grove, Saguache, Granite, Howard, and surrounding communities.
We are very rural here. I mean, we're 60 to 120 miles from the nearest big city, depending on which direction you go, and from the nearest big hospital. So we've prided ourselves on being able to really build the medical services, and the community has supported it. You know, it's sort of a situation where the community has demanded these services, you know, and the minute that we've brought them in, they've become busy. So we have 19 different specialties. One or two of those are combined in the same clinic. Several family practices, a rural health center in BV. We've got 7 providers there, and a walk-in clinic that's open 7 days a week.
When Colorado Rural Health Center staff visited last November, Heart of the Rockies was working to convert their clinic in Saguache, a small community an hour south of Salida, into a certified rural health clinic. The building that houses the Saguache Clinic is an old mercantile structure from the 1800s. The clinic building was donated to the county with the stipulation that there be medical services provided at least 2 days a week. The clinic has served as the only medical facility in the town of Saguache. Following the retirement of a clinic physician, the facility struggled to stay open the minimum weekly requirement. It was at this point that Heart of the Rockies decided to rent the building from the county to ensure healthcare access for Saguache area residents.
I'm Timothy Lovato. I'm a county commissioner, I represent District 3 in Saguache County. I was born in Saguache in 1953, in fact, in this building. The county years ago leased the building out to Dr. Arnett, and he was providing, there was a need for a physician in town, and the commissioners previous to the Board of Commissioners now, they saw a need, and Dr. Arnett saw a need here and had a vested interest in providing health care to the people in this community.
Heart of the Rockies took over the clinic in 2019 and now provides primary care services in the community. They also provide regular pharmacy delivery and physical therapy services. Previously, residents would have had to make the 2-hour round-trip drive to see a provider, receive a healthcare service, or pick up a prescription.
It's just a small little community about an hour from Salida, and it's actually a pretty little community, but it's rural and it's poor, and there aren't a lot of services there, and there's a lot of satisfaction in being able to go and provide needed services to a community like that, where they're just so grateful to have you there. and they really are, they express their appreciation for you being there, because if it wasn't for you, they'd have to drive, anywhere from, 30 to 60 miles to get their health care.
Oh, the value is tremendous. We're an aging population. A lot of seniors can't travel. Transportation, I think, is the key here to providing medical service. And if you don't have good transportation, you don't get medical treatment.
Having those medical services is absolutely essential. I mean, they just don't, their dental, their diabetes is not addressed. It's a big issue down there. I mean, just all the chronic health conditions you can think of are even more prevalent in those rural communities.
We just need something here because we're isolated. I mean, I always worry about my family. And so just knowing that, we at least have a EMS place here really, kind of eases you, but, we need a lot more than just that.
Heart of the Rockies is part of a public hospital district encompassing Chaffee, western Fremont, and northern Saguache counties. The Saguache Clinic is located outside of this area, leaving hospital board members with a difficult decision of whether to support healthcare services outside of their tax district. Hospital board members recognized how important healthcare access is to the entire region and decided to support the clinic with the stipulation that it at least financially breaks even and does not become a cost burden on the hospital district. With these conditions in mind, the Saguache Clinic began the process of achieving a certified rural health clinic designation. RHC designation provides enhanced reimbursement for clinics that serve a high Medicare and Medicaid population to incentivize primary care services in hard-to-serve rural locations.
If we are going to go outside of our hospital district, then we cannot lose. On operations. It has to break even. We cannot, or it has to make a little bit. We can't lose. So we have, being a rural health center, really, a rural health clinic makes all the difference in the world because of the reimbursement methodology that's different than a freestanding clinic. So that will make all the difference. But again, it will be quite advantageous to us to be able to provide those services without incurring a huge loss, which will satisfy our board's criteria for going out of district. It'll also help those people in Saguache, which, they need it. I mean, I don't know who else would go into that community if we didn't.
In the summer of 2019, the Saguache Clinic partnered with the Colorado Rural Health Center to help with the rural health clinic conversion and designation process. The CRHC Clinics team worked closely with clinic staff and the Saguache community to navigate the complex RHC accreditation process.
For a rural clinic who is primarily serving an older population and also generally serving patients on Medicaid, it benefits them because they get enhanced reimbursement for those visits. And it also means that they're not working off the traditional fee schedule, which means for a lot of those visits and the services that they're providing, they're actually getting more money for those. So it definitely, rural health clinic status does not benefit a clinic who participates in mainly very high level specialty type services, but it does benefit a clinic that is in an area with where patients traditionally have limited access, especially to primary care services. And we know that's one of the biggest issues in rural America, rural Colorado.
By February 2020, the clinic passed all required inspections and officially became a certified rural health clinic. Just a few weeks later, the world changed dramatically. By March 30th, Saguache County Public Health had reported its first positive cases of COVID-19 in the county.
So we are constantly monitoring our community and our region for COVID and other things. And basically, we're pretty prepared to react if we have to. We didn't have sufficient PPE. We are blessed that we didn't have the number of patients that we thought we were going to have. because if we would have had the patients that all of the pundits were projecting, we would have been in serious trouble. But we didn't have a big outbreak up here into the hospital like they projected. So we did run short of PPE. We had to use N95 masks over time. We couldn't just dispose of them. We had to figure out all the different PPE for all the different situations, whether or not they go into the OR, what kind of PPE did we have.
Due to an outbreak at a local mushroom farm that employs around 200 people, Saguache County saw higher rates of COVID-19 infection than surrounding counties. Chaffee County experienced multiple COVID-19 deaths at the local nursing home and is currently experiencing an outbreak in the Buena Vista prison, which houses over 1,000 inmates.
The economic impact of shutting everything down because we didn't know how to manage it, at the time it was the breakout, was huge. I've never seen anything so huge from an economic impact of shutting everything down in the hospital, which forced a lot of hospitals to furlough and lay people off, and it created a tremendous amount of disruption and a tremendous amount of insecurity. But the reality of it is it would be the reality of treating the patients in the hospital was very small. The numbers were not there.
Those rainy days come, just like this COVID. If we didn't have that little cushion that we could fall back on, because nobody knows how long this is going to stay and how long it's going to be an impact to our revenue stream, and it's gonna hurt a lot of people if it stays another year and a half.
At the onset of the pandemic, in an effort to protect patients and staff in a resource-limited facility, the Saguache Clinic temporarily closed. When they reopened, their RHC status played an important role in stabilizing clinic operations.
It could have been devastating for them. I mean, we know that at least across the state of Colorado, our primary care clinics, our rural health clinics have seen definitely a significant dip in the volume of patients that they're seeing due to the pandemic. And I think that if they didn't have that enhanced reimbursement for the primary care services that they're providing, that could have been a really big financial hit for them and could have meant that they potentially would have had to close their doors.
Federal and state policymakers issued an unprecedented array of temporary regulatory waivers and new rules to equip rural healthcare facilities with maximum flexibility to respond to the COVID-19 pandemic. For example, the Centers for Medicare and Medicaid Services has allowed greater flexibility for critical access hospital swing beds, which is a care setting for patients who do not require acute care, but do require skilled nursing services. CMS has also waived the Medicare requirements that CAUSE limit the number of beds to 25 and that the length of stay be limited to 96 hours. For certified rural health clinics, CMS is modifying a requirement to allow nurse practitioners, in addition to physicians, to provide medical direction for the clinic's activities and consultation. These temporary rules, among many others, have allowed rural healthcare facilities to keep their communities and staff safe while remaining financially solvent.
There is a patient, we do dialysis here at the hospital. That patient was very fragile. We took him out of the nursing home when they started getting an outbreak, and we put him in our hospital. And I can't tell you how appreciative it was where the government allowed us to not have all these regulations with swing beds where they had to have a 3-day visit beforehand. They couldn't be in there for over 20 days with the copay. We basically took that patient out of the nursing home, put him in our hospital, put him in a patient room to get him away from all the COVID that was going on in that nursing home, kept that patient safe, and treated him in dialysis here. We would have never been able to do that had, I think, not the president or the government said you can bring him into the hospital. Critical access hospitals don't have to have the 96-hour rule. Critical access hospitals can exceed the 25 patients a day. That was huge for us to bring those patients in and keep that patient safe.
if you roll back these rules and regulations, not only is it a huge detriment to access and to getting those needed services to patients, but it's also a really big detriment when it comes to their overall financial stability, right? We know that they need innovative models like this to be able to generate revenue and continue to get business into their clinic. And then I think even further than that, when we look at kind of the patient impact and the continuity of care, if all of a sudden they have to roll back these services, how does that impact their patients, right? And what does that mean for their patient population, who has now gotten used to kind of this new way that they're able to receive primary care services without even having to come into the clinic.
With heightened screening protocols in place, the Saguache Clinic eventually reopened. Patients and providers now rely heavily on telehealth services, which expanded due to temporary rules for RHCs. Before the new rules, RHCs were not reimbursed for providing telehealth visits as an originating site, essentially making it financially impossible for RHCs to provide telehealth services. The temporary state and federal rules greatly expanded telehealth capacity for RHCs by allowing clinics to bill Medicare, Medicaid, and private insurance for healthcare services provided via video and audio. The new rules were intended to expire upon the end of the public health emergency. However, members of the Colorado General Assembly worked diligently during the limited legislative session to codify these rules into law. Senate Bill 212, Reimbursement for Telehealth Services, allows for the continued delivery of telehealth services at RHCs, federally qualified health centers, and Indian Health Services.
I think that we were doing almost during the COVID time, our volumes with telehealth were approximately over 50% of our normal visits were telehealth service visits during this COVID time. So it was a significant number of telehealth visits that probably the patient wouldn't have been treated, or they would have been forced to come into the clinic and be potentially exposed, or expose other people. So it has been significant in our volumes.
In a rural area, in rural Colorado, I know in Saguache is very, very isolated. I imagine a lot of people that live there don't in Saguache. They probably travel far distances. And so if they have to go see their primary care provider, they have to carve out a large chunk of their day to get from wherever they are to the clinic in Saguache.
For rural hospital-based rural health clinics and rural health clinics out there, it's going to provide more access to these communities with providers. We could probably do visits more days a week than the 2 because of the telehealth services. So we could possibly now consider opening it up to maybe 2 days a week of on-site services, and potentially 5 days a week of telehealth services for these people in those rural communities.
Policymakers, healthcare leaders, and fellow advocates, please join CRHC in supporting rules and regulations that allow our rural healthcare facilities the flexibility they need to safely care for their communities, remain financially sustainable, and continue to serve as an important part of Colorado's safety net.